Hi, I'm Andy Rudnick. I'm a cardiac electrophysiologist at Hunterdon Cardiovascular Associates. What really drew me to cardiac electrophysiology was my strong desire to help people feel better when they're not feeling well as my intellectual desire to help understand why things aren't working properly and how to make them work properly when they're not. I'm passionate about what I do because it's really gratifying to me to be able to help people who aren't feeling well to then feel well, to come to me feeling sick, and then to either have medications prescribed or to have a medical procedure done that helps them feel better. I'm also passionate about it because I know from a public health standpoint, cardiovascular disease is a very important public health problem, and to be able to help the public at large is really important to me. The most common types of problem that I treat are arrhythmias. The term arrhythmia is a term which means any kind of an irregularity to the heartbeat, either irregularly fast, irregularly slow, or isolated skipped beats or isolated extra beats. These usually arise as a consequence of some sort of an electrical problem inside of the heart. The most common treatments that I use for people with arrhythmias include anything from simple lifestyle modification, like diet and exercise, to medications, all the way through invasive procedures like pacemaker implantation, defibrillator implantation, or even an invasive procedure called an ablation, which is a medical procedure that's designed to interrupt the electrical pathways that allow arrhythmias to happen. My philosophy of care is that my number one, number two, and number three priority is my patient. I consider that my patient has hired me to give them the right advice and to help take care of them. What's unique about the way I practice medicine is that I consider my role to be to teach you what you need to know in order to make the right choices for yourself. I give you the right information and I give you advice, but I'm giving you advice so that you can make the choice, or we can make the choice collaboratively. In other words, I'm more of an advisor and a teacher and not really an authority figure.